They sold you a fantasy. Every prepper influencer, every survival medicine guru, every tactical medic with a certification they got in a weekend course has been peddling the same dangerous delusion. They show you their 40-pound trauma kit stuffed with chest seals, tourniquets, and Israeli bandages. They call it preparedness. I call it cosplay that gets people killed, because here's what they're not telling you. When hospitals close, when pharmacies get looted, when that cut on your hand turns into a systemic infection that would have been nothing in the old world, the guy with the tactical IFAK full of combat trauma gear is the guy watching his kid die from dehydration caused by simple diarrhea. He's got 6 tourniquets but 0 oral rehydration salts. He can pack a gunshot wound but can't treat the staph infection that'll actually kill him. But here's what'll keep you watching. There are exactly 7 medical items that'll handle 95% of what'll actually kill you when modern medicine disappears. 7 tools that create genuine medical capabilities instead of tactical Instagram photos. And I guarantee the last 2 on this list are items every prepper medkit completely ignores because they're not dramatic enough for the YouTube thumbnail. Here's what stops you first in a medical collapse. Not bullets, not broken bones, not any of the dramatic injuries you're imagining. Contaminated water. You've got maybe 72 hours after drinking pathogen-loaded water before your body starts the cascading failure that ends you. First comes the cramping, then the diarrhea. Relentless, dehydrating, violent expulsion that drains your electrolytes faster than you can replace them. Your decision-making degrades as your brain starves for sodium and potassium. You become weak, confused, unable to defend yourself or make rational choices. Here's the sick mathematics. An adult with severe diarrhea can lose 20 liters of fluid in 24 hours. That's 5 gallons. Your entire circulatory system only holds about 5 liters. You're literally emptying yourself out 4 times over. Without intervention, you're dead in 3 to 5 days. Not from the infection, from the dehydration it causes. And here's the part that'll haunt you. Kids go faster. A child with severe diarrhea can die in 24 hours from dehydration alone. So you bought a pre-made first aid kit with some Band-Aids and antiseptic wipes. Great. Wonderful. Except when your kid has been vomiting and has diarrhea for 6 hours, those Band-Aids are useless. Wrong. You think you'll just give them water, pure, clean water, to replace what they're losing. That'll work. Right. Wrong. Water without electrolytes doesn't absorb properly when the intestines are damaged. You're pouring liquid into a broken system. It goes right through without being retained. You're watching someone die of dehydration while drinking water. You've got Gatorade in your stockpile. That's basically the same as medical rehydration solutions, isn't it? Wrong, wrong, wrong. Gatorade has too much sugar and not enough sodium for medical rehydration. The ratio is wrong. During severe diarrhea, the glucose-sodium transport mechanism in the gut needs a specific molecular ratio to function. Sports drinks miss that ratio by a mile. You're giving them expensive sugar water while their cells scream for proper electrolyte balance. Here's why this is non-negotiable. World Health Organization Oral Rehydration Salts, ORS. Not the concept. The actual WHO formula packets. These packets contain the exact molecular ratio of glucose to sodium that activates the sodium-glucose co-transport system in your intestines. When mixed with clean water, this solution rehydrates a person up to 25 times more effectively than water alone. It's the single greatest advancement in preventing death from diarrheal disease in human history. It's saved over 50 million lives since 1980. Each packet contains 2.6 grams sodium chloride, 2.9 grams trisodium citrate, 1.5 grams potassium chloride, and 13.5 grams glucose. That specific formulation creates an osmotic gradient that pulls fluid back into the bloodstream even when the gut is severely damaged. You need 100 packets minimum. They weigh nothing. They cost about 25 cents each, and they'll save more lives than every tourniquet in your kit combined. But here's where it becomes a capability generator. It's your dehydration treatment for any cause: diarrhea, vomiting, heat stroke, fever. Anything that dehydrates responds to ORS. It's your pediatric life insurance. Kids dehydrate faster than adults. ORS in the correct concentration is safe from infancy through adulthood. It's your physical performance maintainer. Even without illness, hard physical work in heat requires electrolyte replacement. ORS keeps you functional when you're sweating 2 liters per hour doing manual labor. It's your trade commodity. When someone's kid is dying from dysentery, they'll trade anything for the solution. Not because you're mercenary, but because this item has objective life-saving value. It's your morale sustainer. There's something psychologically stabilizing about being able to treat illness. When you can stop a child's suffering, you maintain hope in a hopeless situation. 1 item, 5 life-saving functions. That's the survival triage law in action. Here's the nightmare that starts innocently. You cut your hand while processing firewood. It's shallow, maybe half an inch deep. You rinse it, you bandage it, you move on. In 24 hours, it's red around the edges. In 48 hours, red streaks are tracking up your arm. That's lymphangitis. The infection is spreading through your lymphatic system toward your bloodstream. In 72 hours, you're septic. Your blood pressure drops. Your organs start failing. Your body temperature spikes to 104 degrees Celsius. You're confused, weak, dying. In the old world, this would have been a $15 prescription and a week of pills. In a collapsed world, this is a death sentence. That started with a cut you barely noticed. So you stocked fish antibiotics from the pet store. You read online that Fishmox is the same as human amoxicillin. You've got 100 capsules ready to go. Not enough. Fish antibiotics are unregulated, inconsistently dosed, and have no quality control. You have no idea if each capsule contains 250 or 400 milliliters or 150, so dosing matters. Underdosing creates antibiotic-resistant bacteria. Overdosing causes kidney damage. You're playing Russian roulette with every pill. You've got a bottle of leftover antibiotics from that time you had strep throat. You'll just use those when you need them. Wrong. 1 bottle treats 1 infection maybe. Then what? You've got 1 course of 1 antibiotic. When it's gone, you're back to pre-1940s medicine where people died from infected splinters. You think natural remedies will work. Honey for wounds, garlic for infections, herbal poultices for inflammation. Wrong, wrong, wrong. Honey has mild antibacterial properties. Garlic has some antimicrobial effects. They're supportive care, not curative treatment. When you're septic, honey isn't going to drop your bacterial load fast enough to save your life. You're bringing folk remedies to a biological gunfight. You need a real antibiotic stockpile, not fish pills. Human-grade medications obtained legally through proper channels. Here's the system. 3 antibiotics that cover the majority of common bacterial infections you'll encounter. Amoxicillin 500 ml, broad-spectrum coverage for respiratory infections, skin infections, dental infections. Stock 200 capsules minimum. Doxycycline 100 ml, covers tick-borne diseases, respiratory infections, and certain resistant bacteria. Stock 100 capsules minimum. Metronidazole 500 ml, specifically treats anaerobic bacteria and parasitic infections. Covers dental abscesses, gut infections, and wound infections in deep tissue. Stock 100 tablets minimum. It's your pneumonia treatment. Respiratory infections kill more people in collapse scenarios than almost anything else. Amoxicillin and doxycycline handle most pneumonia-causing organisms. It's your wound infection cure. That cut that's turning red? Amoxicillin stops it before it becomes sepsis. It's your dental emergency solution. Tooth abscesses are excruciating and can spread to your brain. Metronidazole plus amoxicillin is the standard treatment protocol. It's your UTI handler. Urinary tract infections are common, painful, and can progress to kidney infections that kill. Doxycycline treats most UTI organisms. It's your Lyme disease defense. Tick-borne illnesses explode when people are living outdoors more. Doxycycline is first-line treatment. It's your community health insurance. When someone in your group develops a serious infection, you can intervene. You become the medical infrastructure. 3 medications, 6 life-threatening conditions prevented. 1 antibiotic stockpile, dozens of lives saved. Here's what kills quietly. Chronic disease without medication. Maybe you're diabetic. Your insulin lasts 28 days unrefrigerated before it degrades. After that, your blood sugar spirals. Hyperglycemia leads to diabetic ketoacidosis, which leads to coma, which leads to death. Timeline 7 to 10 days without insulin. Maybe you're hypertensive. You miss your blood pressure medication. Your systolic pressure climbs from 130 to 180 over a few weeks. Then you stroke out while hauling water, dead at 45 from something completely preventable. Maybe you're asthmatic. You run out of rescue inhalers. You have an attack triggered by smoke or stress or cold air. Your airways constrict. You can't breathe. You suffocate while your lungs are still functional, so you've got a 30-day supply of your regular medications. That's standard. That'll get you through the initial chaos. Not enough. 30 days means you're dead on day 31. You haven't prepared. You've just delayed the inevitable by 1 month. You think you'll stockpile a year's worth of prescription medications. You'll ask your doctor for extra refills and build a reserve. Wrong. Insurance companies track this. Doctors won't prescribe it. Pharmacies won't fill it. You're legally and practically blocked from amassing the supply you'd need. Plus, many medications degrade or expire. You can't just sit on a pile of pills for years. You believe you can find alternatives, natural blood pressure solutions, dietary diabetes management, breathing techniques for asthma. Wrong, wrong, wrong. Type 1 diabetes requires exogenous insulin, period. There's no dietary fix. Severe hypertension needs pharmaceutical intervention before you die from an aneurysm. Acute asthma attacks need bronchodilators, not deep breathing. You're confusing management with cure, and that confusion kills. Here's the item nobody packs: medical protocols and medication knowledge documented in physical, waterproof form. Get this: Where There Is No Doctor by David Werner. 500 pages of medical protocols designed for areas without medical infrastructure. It covers diagnosis, treatment, medication dosing, and improvised interventions. It's used by Peace Corps volunteers, missionary medical workers, and remote clinic staff worldwide. Add The Survival Medicine Handbook by Joseph Alton and Amy Alton, written specifically for grid-down medical scenarios by an actual physician and nurse. It includes dosing charts, emergency procedures, and improvised medical techniques. Here's why this is non-negotiable. Medical knowledge is perishable. Under stress, you forget protocols. Dosing errors kill people. These books are your external medical brain when your actual brain is overwhelmed. It's your diagnostic manual, symptoms described, conditions explained, differential diagnosis guided. You become capable of medical reasoning beyond something's wrong. It's your treatment guide, step-by-step protocols for dozens of conditions. You don't need to remember everything. You need to look it up when it matters. It's your medication safety system, drug interactions, proper dosing, contraindications. You avoid killing someone by giving them the wrong dose or wrong drug combination. It's your training library. Before collapse, you use these to learn. You practice procedures, memorize protocols, understand pathophysiology. When crisis hits, you're not starting from zero. It's your community medical asset. You become the person people come to for medical guidance, not because you're a doctor, but because you have the information architecture to help. 3 books, 1,500 pages of medical protocols. 1 knowledge base, countless lives impacted. Here's what happens faster than you think. Someone gets a deep laceration. Could be from broken glass, a knife slip, a fall onto debris. The wound is 2 inches long, gaping, bleeding steadily. In the old world, this is 12 stitches in an ER, 45 minutes, local anesthetic, professional closure, sent home with aftercare instructions. In a collapsed world, this is a potential death sentence. Without proper closure, the wound continues bleeding, remains open to infection, and won't heal correctly. The person loses blood, risks infection, and ends up with a horrific scar that limits mobility if it's over a joint. You've got maybe 4 hours from injury to closure for optimal healing. After that, the wound edges begin to change. Tissue starts dying back. Contamination deepens. Your window for primary closure is closing. So you bought a suture kit off Amazon. $20, comes with practice skin, curved needles, and thread. You watched a YouTube video. You're ready. Wrong. Suturing requires manual dexterity, sterile technique, anatomical knowledge, and practiced confidence. Under stress, with poor lighting, on a person who's moving and in pain, your YouTube education becomes a butcher job that creates worse outcomes than leaving the wound open. You cause more damage than you fix. You've got duct tape and super glue. You'll just tape the wound shut or glue it closed. Same thing as stitches, basically. Wrong. Duct tape isn't sterile, doesn't maintain consistent pressure, and fails when wet with blood. Super glue, unless it's medical-grade cyanoacrylate, causes tissue inflammation and isn't designed for deep wounds. You're improvising with tools that don't match the problem. You think you'll use butterfly bandages, those little adhesive strips that pull skin together. That's what they're for, right? Not enough, not enough, not enough. Butterfly bandages work for superficial lacerations in low-tension areas. For anything deeper than 1/4 inch or across joints or under tension, they fail. They peel off, they don't achieve proper wound edge approximation, and they give you a false sense of security while the wound festers underneath. Here's what works: sterile wound closure strips, Steri-Strips, skin adhesive, medical grade, and proper technique training. Steri-Strips. These are reinforced adhesive strips that maintain wound closure for 7 to 10 days. They're applied in a specific pattern that distributes tension and achieves wound edge approximation. They're used in actual emergency rooms for appropriate wound types. Stock 50 envelopes of assorted sizes. Derma Bond, or equivalent medical-grade tissue adhesive. This is Liquid Stitches. 2-octyl cyanoacrylate, specifically formulated for skin closure. It creates a waterproof seal, holds for 5 to 10 days, and sloughs off naturally as the wound heals. It's faster than suturing, and for appropriate wounds, outcomes are equivalent. Stock 12 individual use vials. Here's why this is non-negotiable. These tools require minimal training, work reliably under field conditions, and produce results that prevent the 2 major wound complications: continued bleeding and infection. You're maintaining wound integrity without requiring surgical skills. It's your laceration management. Properly closed wounds heal faster, scar less, and hurt less. You're returning people to function instead of letting them become disabled by poorly healing injuries. It's your infection prevention. Open wounds are infection highways. Proper closure reduces bacterial load and keeps contaminants out during the critical healing phase. It's your pain reducer. Closed wounds hurt less than open wounds. You're providing comfort and reducing suffering. It's your resource conserver. Closed wounds need less frequent dressing changes, less monitoring, less ongoing care. You free up time and supplies for other medical needs. It's your confidence builder. When you can handle a bleeding wound effectively, you prove to yourself and your group that medical crises are manageable. Morale impact is substantial. 2 wound closure systems, 5 critical functions, 1 skill set, dozens of wounds properly managed. Here's what reduces you from functional to liability faster than almost anything else: injury-induced inflammation. You twist your ankle badly. The joint swells to twice normal size. You can't put weight on it. You can't walk. You can't haul water, gather firewood, or defend your position. You're immobilized, dependent, and vulnerable. In a survival situation, immobility equals death. That ankle will take 6 to 8 weeks to heal naturally. You don't have 6 to 8 weeks of being non-functional. You need to be mobile in 48 hours, or your survival odds collapse. So you stocked opioid painkillers. You've got hydrocodone or oxycodone from old prescriptions. Strong pain relief for serious injuries. Wrong. Opioids mask pain but do nothing for inflammation. Your ankle still swells. The tissue damage continues. Plus, opioids cause constipation, mental fog, and physical dependence. You're treating the symptom while making yourself less capable and potentially addicted. You've got a giant bottle of acetaminophen, Tylenol, that handles pain and fever. That's enough. Wrong. Acetaminophen is an analgesic and antipyretic, but has 0 anti-inflammatory properties. It'll make you feel better while doing nothing to address the underlying tissue swelling that's actually disabling you. Plus, acetaminophen overdose causes liver failure. It's dangerous when you're trying to manage pain long-term. You think you'll just tough it out. Pain is weakness leaving the body. Mind over matter. You'll push through. Wrong, wrong, wrong. Uncontrolled inflammation damages tissue, prolongs healing, and increases the risk of chronic problems. Your toughness doesn't reduce swelling. Your mindset doesn't stop prostaglandin synthesis. You're confusing stoicism with stupidity. Stock 1,000 tablets of ibuprofen 200 milliliters each and 500 tablets of naproxen sodium 201 or each. These are non-steroidal anti-inflammatory drugs. NSAIDs. They work by inhibiting cyclooxygenase enzymes, COX-1 and COX-2, which reduces prostaglandin production, which directly decreases inflammation, pain, and fever at the source. Ibuprofen, fast-acting 4 to 6 hour duration, your acute injury response. Naproxen, slower onset, 8 to 12 hour duration, your sustained inflammation management for chronic issues. Here's why this is non-negotiable. Inflammation is the body's response to injury, but excessive inflammation causes secondary damage. NSAIDs interrupt that cascade. They keep you functional when injuries would otherwise disable you. They're force multipliers for human capability. It's your injury recovery accelerator. Reduced inflammation means faster healing. You're cutting recovery time from weeks to days for appropriate injuries. It's your mobility maintainer. Sprained ankle. NSAIDs reduce swelling enough to allow weight bearing in 48 hours instead of 7 days. That's the difference between functional and helpless. It's your fever manager. High fevers damage organs. NSAIDs safely reduce fever while your body fights infection. You're preventing febrile seizures in kids and organ damage in adults. It's your dental pain solution. Tooth pain is among the worst pain humans experience. NSAIDs work better for dental inflammation than opioids. You're keeping people sane during dental emergencies. It's your arthritis treatment. For people with chronic joint issues, NSAIDs are the difference between mobile and bedridden. You're maintaining your group's productive capacity. It's your menstrual cramp relief. Women still have periods during collapse. Severe cramping is debilitating. NSAIDs are the gold standard treatment. 2 medications, 6 critical functions, 1 anti-inflammatory system, group capability maintained. Here's the threat that sneaks past everything else. Intestinal parasites. You drink water from a stream. It looked clean. You filtered it through cloth. You even let it sit overnight. 2 weeks later, you're experiencing cramping, diarrhea, and fatigue that won't quit. You've lost 15 pounds. You're weak, dehydrated, unable to keep food down. You've got giardiasis, or cryptosporidiosis, or amoebiasis, parasitic infections that antibiotics don't touch because parasites aren't bacteria. They're complex organisms that laugh at amoxicillin. Without treatment, these parasites colonize your gut, damage your intestinal lining, and slowly starve you to death while you're still eating. You can't absorb nutrients. Your body cannibalizes muscle. You fade away over months. So you've got a water filter. It removes bacteria and protozoa down to 0.1 microns. You're protected. Not enough. Filters clog. Filters crack in cold weather. Filters get damaged, and you don't notice until you're already infected. Plus, you can't filter everything. Sometimes you need to drink water right now, and you don't have time to pump 2 liters through a ceramic element. You think boiling water kills parasites. You'll just boil everything and you're safe. Wrong. Boiling absolutely kills parasites and their cysts, but boiling requires fire, fuel, time, and a container. When you're mobile, under threat, or fuel scarce, boiling every liter becomes impractical. You'll eventually take a calculated risk, and that's when parasites get you. You believe you'll just avoid untreated water entirely. You'll only drink from sealed bottles or known clean sources. Wrong, wrong, wrong. In a prolonged collapse, sealed bottles run out fast. Clean sources get contaminated. You will eventually drink questionable water. It's not if, it's when. And when you do, you need a pharmaceutical backup that actually works. Stock metronidazole, already covered under antibiotics, but add these. Albendazole 400 milliliters tablets, broad-spectrum anti-parasitic, treats roundworms, hookworms, tapeworms, and whipworms. It's the WHO's drug of choice for soil-transmitted helminths. Stock 50 tablets, tinidazole 500 milliliters tablets. More effective than metronidazole for giardia and amoeba. Single-dose treatment in many cases. Stock 30 tablets. These medications work by disrupting parasite metabolism. They're absorbed in your gut, kill the parasites, and you expel them naturally over days. Symptoms resolve within a week. Here's why this is non-negotiable. Parasitic infections are endemic in areas with poor water sanitation. That's exactly what you'll have in a collapse. Without antiparasitics, you're defenseless against organisms that'll slowly destroy you. It's your Giardia cure. Tinidazole 2G single dose and giardiasis is resolved in 90% of cases. You go from debilitated to functional in 3 days. It's your comprehensive worm treatment. Albendazole handles intestinal worms with 1 to 3 day treatment protocols. You're clearing infections that would otherwise persist for months. It's your community deworming program. When multiple people are infected, and they will be, you can treat everyone systematically. You prevent the chronic malnutrition that destroys group capability. It's your preventive tool. In high-risk situations, prophylactic anti-parasitic treatment is justified. You're stopping infections before they establish. 2 medications, 4 life-saving functions, 1 anti-parasitic protocol, group health maintained. Here's the crisis that requires immediate action. Cardiac arrest or respiratory failure. Someone chokes, drowns, has a heart attack, suffers anaphylaxis, or takes trauma that stops their breathing. You've got 6 minutes before brain damage becomes irreversible. You've got 10 minutes before biological death becomes certain. Every second counts. Every compression matters. And all your medical supplies are useless if you don't know how to manually restart human physiology. So you took a CPR class 10 years ago in high school. You remember the basics. You'll figure it out if you need to. Wrong. CPR skills degrade within 3 to 6 months without practice. The compression depth, rate, and hand position you have to remember are probably wrong. Under stress, with a real person dying in front of you, your decade-old classroom memory will fail catastrophically. You think CPR doesn't really work anyway. You've heard the survival rates are terrible. Why bother? Wrong. Bystander CPR doubles or triples survival rates for cardiac arrest. For drowning or choking where the heart is still functional, rescue breathing alone has 60 to 80% success rates. CPR works when done correctly and immediately. The terrible statistics come from delayed intervention and poor technique. You believe you'll just call 911 and let professionals handle it. That's what they're trained for. Wrong, wrong, wrong. There is no 911 in collapse. There are no paramedics. There's no ER down the road. You are the medical system. If you can't intervene, that person dies while you watch helplessly. Get current CPR and first aid certification from the American Red Cross or American Heart Association. Not the online version, the in-person hands-on class where you practice on mannequins until muscle memory forms. Learn adult, child, and infant CPR with proper compression depth. 2 inches for adults, about 1.5 inches for children. Correct compression rate, 100 to 120 per minute. Rescue breathing technique and ratios. Choking intervention, Heimlich maneuver. Recovery position for unconscious but breathing patients. How to use an AED if available. Then recertify annually. Skills fade. Practice maintains them. Additionally, stock a CPR barrier mask, prevents disease transmission during rescue breathing, and learn to use it. Here's why this is non-negotiable. CPR is the only intervention that gives you a chance to reverse sudden death. Without it, you're accepting that cardiac or respiratory emergencies are automatic fatalities. With it, you have a fighting chance to bring someone back.